Hi, my name is Monica Esquivel. I'm an assistant professor at the University of Hawaii at Manoa. Today I'll be sharing about the Keiki produce prescription research study. I'm sharing today on behalf of our team here. We have Alicia Higa, May Okihiro, Sharice Shelton, Ruth Kaeo, as well as Kenny Parisa. Our work is the result of a community-based research partnership that aims to make healthy, affordable, locally grown food available to all in Hawaii, as well as to support a health-based food system. Here you can see the images of our partners on the right, their logos. We believe our program utilizes community strengths to identify and solve issues around health disparities such as food insecurity and other social inequalities. Our research aims to measure the effect of the Keiki produce prescription program on child fruit and vegetable intake and household food insecurity. We also aim to identify factors that influence participation in the produce prescription program. As a research participant in the Keiki produce program, you would first enroll in the study after a clinic visit where a pediatrician might screen you for food insecurity. Participants who've screened positively for food insecurity are referred to the Keiki produce team through the EMR or electronic medical record. The Keiki produce prescription research staff will get in touch with participants, and first baseline data is collected where we assess fruit and vegetable intake as well as household food insecurity status and other demographic variables. Participants then receive $50 a month in vouchers to purchase fresh fruits and vegetables at the farmers market or online market for 6 months. At the end of their participation, we re-administer the baseline surveys. Like many of you, we've experienced a number of challenges over the past 2 years. First, our survey was adapted to expand fruit and vegetable consumption to measure both parent and child intake, and we've expanded the food security questions. This was as a result of issues and delays in recruitment, which have led to a reduction in our participants from 200 to 100 participants. We also were able to overcome challenges with redemption as the farmers market was closed during much of the pandemic. We were able to identify an online marketplace to accept our vouchers and that also offered home delivery of produce. Lastly, the education we had planned to take place at the farmers market was pivoted to home food and activity bag kits. Some of our project impacts. We've enrolled 121 research participants and 60 of them have completed all research activities, and we have 32 who are currently in progress. We've had over $15,000 in fruit and vegetable vouchers redeemed. We've conducted exit interviews with a number of our participants, and we found that they're participating because they fall within an ALICE category, which means they make just more than enough household income to qualify for food stamps and other benefits, but they are still struggling to make ends meet. They also are participating because their doctor recommended it. They're finding that the program's easy to participate in. The vouchers are just as good as cash. Things that they're struggling with that make it difficult to participate are scheduling to get to the market on the weekends. What they like about our food and activity bags are the recipes and other interactive activities, and they're hoping in the future we have more of those activities and that the recipes and fab kits might better align with what's available in the market. Other project impacts include a number of different presentations and abstracts that have been submitted and been performed at both local and national conferences. We've also had a number of training activities with one doctoral student, Sharice, who's completing her dissertation research on the fab kits. We've had 2 undergraduate student research experiences at 100 hours for each. And I myself am an early stage investigator and participating in this study. Our next steps, so between now and the end of May, we anticipate finishing up with our data collection. Through the summer, we'll be analyzing our data, and soon we'll begin disseminating through peer-reviewed publications, other presentations, as well as writing proposals for future funding. Mahalo for listening, and I hope you have a wonderful conference.